our health, our viewers on this Sunday morning. Health Hour with Apollo 24/7's experts is a show where we bring you experts from Apollo hospitals all over the country to this live show. 11 to 12, you have an opportunity meeting our experts and asking your questions and queries, and we will bring you answers from our expert. You must be watching this on Facebook pages, you must be watching this on YouTube as well. But if you have a query, I request our audience to hop on to the YouTube chat and type your question there. From there, I'm going to take the questions. You must be watching it everywhere, but if you have a question, please come on to YouTube, type your query in the chat box with all the details possible, like age, gender, question, all the medications, or everything into one, so that it will be easy for me to frame the question and place it before our expert. So I shall wait for you to join us in the YouTube chat and ask your questions, because everything is about the questions. It's your question because it's going to give answer to many more. And today we are going to talk about thyroid imbalance, and we are bringing you an expert endocrinologist to the show. Today we are going to talk about everything. Are you at risk? What are the symptoms? How can you control it? And how can you lead a balanced life? Here we have our expert, Dr. Mithun Bhartia, endocrinologist from Apollo Hospitals, Guwahati, who is going to join us very soon on to the show. You can ask all the questions, and let me introduce our specialist for the day. And our Dr. Mithun Bhartia is an endocrinologist. As I've mentioned, he is joining us from Assam, Guwahati से join कर रहे हैं. डॉक्टर साहब का एक्सपीरियंस रहा है, 12 साल से वो अपोलो के साथ जुड़े हुए हैं, and प्रोफेशनल मेंबरशिप्स ऑफ डॉक्टर MRCP UK से है, MRCGP UK से है, FECSM एम्स्टरडैम से है, एंड काफ़ी सारे नेशनल टेक्नोलॉजी टास्क फोर्स मेंबर RSSBI से है. He is the National Secretary of Association of Clinical Endocrinologists. He has completed his CCT in endocrinology from UK. He is a co-founder for DTech, which spearheads the latest technological advancements in diabetes in India. And he can be consulted for diabetes, thyroid, and sexual problems as well. So let me welcome Dr. Mithun Bhartia to the show. Very good morning, Doctor. Namaskar.
Very, very good morning.
Yes, Doctor. Happy to see you here on a Sunday morning.
Thank you for the invitation. I hope we can make this an enjoyable morning for all our viewers as well.
Yes, quite an information and a powerful morning that I could say, because everything about health is how much information you have about how aware are you about your condition. So I understand that endocrinologists are very rare to find, and especially in the region that you are, and the kind of service that you do across the country is commendable, Doctor. So let me start by asking one basic question. What is a thyroid function? What is this gland doing? Where is it sitting, and how is it controlling our lives?
You see, Jhansi, the beautiful thing about endocrinology is that the glands are very small, but they're very powerful. And in terms of when we ask people, when people get worried about, mera height nahi badha, ya fir, I want to be 6 feet and I'm 5'3" and I cannot achieve something. A typical example is an endocrine gland. Now, a thyroid gland is like a butterfly which is in the neck. It's got 2 wings. It's got a central body. It's around here. And this is controlled by just a pea-sized gland in the pituitary in the brain, which is just the size of a small piece of butter, which is the headmaster of all the glands in the entire body. So I think once we think how God is created, it's a wonderful creation. You start appreciating the effort of God and how He has created the whole mechanism of action. So this thyroid gland, which is here in the neck, when people come to us and say, "Sir, mera thyroid gland kaam nahi kar raha," ya mere ko thyroid ho gaya, that's a typical question that people ask. I've got thyroid now. Boss, you have thyroid since you were born. Now you're talking about whether that is functioning well or not functioning well. But that is how people actually address, now I've got thyroid, and they're very worried about it.
वो तो एक कॉमन भाषा जो परिभाषा हो जाती है उसमें हो जाती है. वी अंडरस्टैंड दैट मुझे साइट है, वैसे तो साइट आपको है ही, सो साइट का इश्यू है, सेम वे थायराइड का इश्यू है, पर उसको बोला जा रहा है कि मुझे थायराइड हो गया है. तो आई अंडरस्टैंड दैट पीपल आर वरीड अबाउट इट, बट वी डोंट नो हाउ इट अफेक्ट्स अस. सो बिफोर आवर ऑडियंस आर टाइपिंग क्वेश्चंस, आई सी दैट वे बियॉन्ड, उनका नाम एंड एज जेंडर कुछ दिया नहीं है. I will take questions very shortly. Way beyond, आप जो भी हो, कौन से भी जेंडर के हो या कहीं से भी हो, can you please add your age, your height, and other details also into the question so that I can place your question before Dr. Mithun. So, doctor, how does thyroid, the gland which is functioning, जो भी secrete कर रहा है, वो कितना secrete करना चाहिए और why does it help us and what are the functions that it does?
So the thyroid gland controls the metabolism of our body, how fast and how slow we are. And that is why when there is an imbalance, when the thyroid gland is not producing enough thyroid hormones, the whole thing becomes very slow. And when it's producing a lot of hormones, the whole thing becomes very fast. So when it becomes slow, everything, the reflexes become slow. We tend to put on weight. Our voice becomes huskier. There is swelling in the body. When it becomes fast, people get diarrhea, people get weight loss, people get sweaty palms, people get pulse rate getting fast. So it's the metabolism of the body which is actually controlled by the thyroid. Hence, whenever there is something else happening in your body, you see, thyroid, if I use this analogy because thyroid is like a mother. If
अच्छा.
something goes wrong with the child, the mother always takes the onus ki meri galti hai. Whereas if something else is going wrong in your body, say you have anemia, say you have some other medical condition, the first thing the body thinks is that my thyroid is wrong. And so it tries to auto-regulate its system, and hence you get slight abnormalities of the thyroid function which are transient, which if you control the main condition, it will revert back to its normality. And
Okay.
here is the misdiagnosis of thyroid condition, which often happens, which is not under the remit of endocrinologists, because the patient is then put on a sticker that you have a thyroid problem for life.
Right. So, तो ये जो थायराइड प्रॉब्लम जो हम बोलते हैं, तो इसे कैसे आइडेंटिफाई करें कि हम कुछ तो गड़बड़ है यार, कि ये अभी थायराइड को पॉइंट आउट कर सकते हैं. तो व्हाट आर द सिम्टम्स और फर्स्ट लाइन दैट आई कैन फाइंड फ्रॉम माय बॉडी? सिग्नल क्या है?
See, there are many signs and symptoms. As I said, आप underactive हो सकते हो या आप overactive हो सकते हो. But in females, God has created a beautiful system which may be a little hassled for a few days, which is called the menstrual period. If anything is wrong with the menstrual period, the female takes action immediately. So,
जी.
thyroid problems can cause problems in the period. If the body's thyroid is not secreting enough thyroid hormone, the reverse happens, the woman bleeds more, generally speaking.
ओके.
If the thyroid is overactive, then the woman bleeds less. So, generally, if there is an abnormality of your menstrual period, you should always try to get a thyroid screening done. That is, and females are very, they sense that problem that is happening, and they often see their gynecologist, first port of call, and they often check their thyroid if you have got menstrual irregularities. The second, which is oversensitive nowadays in the size zero world, is people putting on even half a kilogram or in 1 kilogram, they try to find an easy answer. And the thyroid becomes a sitting duck for checking. Yes, if you put on a lot of weight or you find it difficult to lose weight, then thyroid could be the reason that could be attributed to. But in general speaking, if the body, as I said, is on a slow version, that the body is not producing enough thyroid, then the person may put on weight. The other way, if the person is secreting a lot of thyroid hormones, then the body will lose weight. So, weight abnormalities, if your weight is changing beyond what you are intending to do, say you are going to the gym, eating less, exercising, and you are losing weight, then not is the case. But if unintentional weight loss or unintentional weight gain is something that might prompt a thyroid test for most common people. So menstrual irregularities, any
Wait.
problems with your weight. The third is if you find that the reaction time of the person is getting less, so the body is slowing down. There is puffiness around the eyes. There is swelling of the body. That itself may promote that the body's thyroid system is working very slowly. So any swelling, generalized swelling, not localized swelling. Localized swelling is एक ही जगह
एक
पे
ही
तो वो
जगह
उसी जगह पे जनरल आपकी बॉडी स्वेल अप कर रही है या आपके अराउंड पफीनेस हो रहा है, दैट कैन शो दैट द बॉडी थायराइड इज नॉट इनफ वर्किंग. सिमिलरली अगर आपका थायराइड हार्मोन बहुत ज्यादा बना रहा है, तो इन सम पीपल द आई बॉल्स प्रोट्रूड आउटसाइड. You find that as staring, you keep on staring at something. So वो look अगर आपको हो रहा है, so that again is another promptness that your thyroid is irregular and you might need a thyroid check. So somebody who's having bulging eyes, somebody whose eyes are protruding, people are noticing, they're looking in the mirror, I'm not looking the same, that is another prominence. Fourth and fourth and fifth common causes are the two Ds. One is depression.
Oh,
If If a person is depressed or newly depressed, you must check your thyroid function test because an underactive thyroid may cause you to feel low, and that can be easily reversible. Another
yeah.
D is dementia if your memory is not very good. So if you are finding that your memory, you're kind of losing your memory a little bit, this is a reversible cause of dementia. It is, a simple blood test, a simple solution, not too expensive, and you can enjoy your life better. So this is another uh, important point, that a dementia or depression. And lastly, any other condition which you are autoimmune in nature. By autoimmune, we means these are conditions which the body attacks itself. And हमारे यहाँ जैसे बोलते हैं ना, एक भगवान चलते हैं तो दो भगवान साथ चलते हैं उनके साथ साथ. तो लक्ष्मी जी, सरस्वती जी सब साथ आते हैं. So if one sister is walking, the two twin sisters and all the sisters are walking. So if you have got diabetes, which is an autoimmune condition, if you have got vitiligo, which is white patches on the body, if you have got a condition which is celiac disease, that is आटा मैदा का एलर्जी, गेहूं का एलर्जी, all these conditions, there's another autoimmune which is thyroid. Thyroid is
Yeah.
autoimmune condition. So if you have any one of the autoimmune conditions, you must check your thyroid function test every year.
Yes. So now I understand the symptoms and signs. और ऑडियंस भी ज्वाइन हो चुके हैं इन गुड नंबर्स. अब्दुल कलीम जी, एकता साहा, सुप्रीति Paul, and Navneeta. I'm going to ask you questions very soon. But just before I take the questions from the audience, because they'll start to ask their personal questions, in the larger benefit of the audience, I would want you to answer कि अगर हमें पता है कि थायराइड इम्बैलेंस में जा रहा है with all these symptoms, how well can that be corrected? एंड द मिथ की, आई डोंट नो इफ इट इज अ मिथ, कि एक बार लोग समझते हैं कि उनका थायराइड है प्रॉब्लम तो पूरा वेट उसी के ऊपर डाल देते हैं, बोझ उसी के ऊपर डाल देते हैं, थिंकिंग दैट इट कैन नेवर बी करेक्टेड. इज दैट ट्रू दैट द वेट लॉस गेट्स डिफिकल्ट?
So I think if it is the thyroid which is predominantly causing your weight fluctuations, if you can get that thyroid back to normal, जो थायराइड के कारण हो रहा था वो नॉर्मल हो जाएगा. सी वेट इज अ वेरी सेंसिटिव सब्जेक्ट. यू सी, ऑल ऑफ अस वुड लाइक half a kilogram from here or 1 kilogram from here and there to go away. So I think if it is because of the thyroid, उसको आप recorrect करेंगे तो you will be back to what a person without thyroid or in your body, because everybody's body is different. So how your body would have reacted. But secondly, as I brought that Jhansi up in the beginning, you see a lot of people feel कि मैंने अगर थायराइड की दवाई खाई है, मैं कितना दिन खाऊं. जैसे आपने पूछा कैन इट बी करेक्टेड. सी आपकी गाड़ी है, आप गाड़ी में पेट्रोल भरते हो, आपने 4 साल तक गाड़ी में पेट्रोल भरा, 5वां साल गाड़ी अपने आप तो पेट्रोल नहीं बनाएगी. तो अगर आपकी बॉडी पेट्रोल नहीं बना रही है, तो आपको पेट्रोल रोज सुबह डालना पड़ेगा. तो इज एज सिंपल एज दैट. व्हेन यू आर वेक अप इन द मॉर्निंग, आप ब्रश करते हो, आप 3 दिन ब्रश करोगे तो चौथा दिन दांत अपने आप तो ब्रश नहीं करेगी. वैसे इफ योर बॉडी इज नॉट प्रोड्यूसिंग थायराइड, यू हैव टू रिप्लेस द थायराइड. एंड दैट इज वेयर द इम्पोर्टेंट थिंग इज दैट इट इज अ ट्रीटमेंट फॉर लाइफ. द डोजेस में चेंज because of various reasons of the body's physiology and other interaction or other conditions. But you have to, if you truly have a thyroid condition, but what that means is that body is not producing thyroid hormone, then you need to replace that with your thyroid hormone for the rest of your life. If you're overproducing thyroid, is different.
या सो डॉक्टर, पहले हम टाइप्स ऑफ इम्बैलेंसेस बात कर ले कि जो ज़्यादा क्या है और कम क्या होता है, उनको कैसे हम आइडेंटिफाई करते हैं, ये आपने बता दिया है, बट व्हाट आर द टू मेजर टाइप्स ऑफ इम्बैलेंसेस?
The two major types of imbalances are when your body produces less thyroid. When it is less, we call it hypo. So the hypo
ओके,
may there are only four letters in the word HYPO. When the body produces excess, we call it hyper. So there are five letters in the word HYPER. So in that way, when your body is producing more, you've got more letters. When your body is producing less, you've got less letters. So in that is how you basically divide the thyroid mechanism into hypothyroidism and hyperthyroidism.
right. So that was easy for me to remember. Suddenly I was feeling as if I'm sitting in a math class learning a simple hack of a formula. Well, thank you, Dr. Mithun. So let me quickly take questions. So, are there any foods to be avoided? Ekta Saha is asking this question. Uh, अक्सर हमारे यहाँ फूड एंड थायराइड इम्बैलेंसेस रिलेट किए जाते हैं कि स्लगिश बनाता है, कैबेज मत खाओ, कॉलीफ्लावर मत खाओ, टोमेटो मत खाओ. इज दैट ट्रू? डू वी नीड टू अवॉइड सर्टेन फूड्स?
So as a rule of law, but I've been doing this for the last 15 years plus, I've never found somebody who loves cabbage and cauliflower and wants to eat it every day.
Oh, I love gobi,
So
doctor, please. I love
yeah, but
gobi.
agree. But what I meant to say was cauliflower. Okay. So I also love gobi. So what I'm trying to say, you have to understand, we have to work our life with the thyroid. We cannot take our life away from thyroid. If you love gobi, you must have gobi sometimes. If I divide you from what you like and what you love, I'm not a good doctor. But if I tell you is that when you have it in little quantities and you have it in less frequently, that will be acceptable to you. That will be acceptable to me as well.
Okay.
So these foods which you talk about, these are goitrogens which increase the swelling in the neck. So yes, we say don't have it on a regular basis. In fact, I say that. I don't know what others might say. I don't advise them कि एकदम मत खाओ भाई आपका मन करता महीने में एक दो दिन खाना तो खा लो कोई बड़ी बात नहीं है. The only thing which I try to say is that avoid it on a regular basis, which is the same mechanism of action, is soya milk. Some people drink soya milk. So if you're going to drink soya milk, you're going to drink it every day, maybe twice a day. So something which you're doing it on a daily basis, maybe avoid. But occasionally, if you're having it and if you really like it, then go ahead and have it. We will adjust your doses. We don't want to take your life away from these foods.
All right. So soya is something that you have to watch out for. And ये जो हम गोभी, आलू, मटर, इन सब के बारे में goitrogens, any other food that you would
तो
want to add into this?
मटर में कोई तकलीफ नहीं है. मटर में कोई तकलीफ नहीं, आप खा सकते हो. सो कॉलीफ्लावर, कैबेज, the family of these, there is a little bit of an effect on goitrogens. But again, as I said, if you want to take it occasionally, it's not an issue. Soya is not an issue. Nobody will have soya every day. People may have soya milk every day. So that is the difference. If you're going to
Great.
drink the milk every day, that is the difference.
Right. So now let's come to the question of dosage. जैसे आपने बोला है कि dosage आप increase करेंगे या decrease करेंगे. Once ये मैंने सुना है कि once you have an issue with thyroid, it can never be corrected and you will have to take the hormone replacement for life. Is this true? And because यहाँ पर किसी ने पूछा था, इनका नाम मैं मिस कर चुकी हूँ. I will figure out. But on a larger note, if you can explain that to us.
But so, as I said, you have to take it every day in the morning. And generally, we advise that you take it empty stomach. And then you don't eat and drink for some time so that the absorption of the dawa is better. You see, and when I came to India, that was very difficult in explaining to our people कि मैं तो ये खाती हूँ, मुझे ऑफिस जाना है, मुझे यहाँ जाना है, मुझे वहाँ जाना है. So Indian people, we take the maximum value for our buck. तो मैं उनको ये बोलता हूँ भाई पैसे तो आपके लग चुके हैं, अब वो पैसा पूरा वसूल कर लो, आप थोड़ा वेट कर लो खाने के पहले. So then you can वसूल पूरा आपके दवाई का पैसा, because we don't even want one tablet of our script to go wastage. If you change medication, बोलते सर वो तो पड़ा हुआ है, 2 दिन खा लेती हूँ फिर नया खरीद लूंगी. So that people are very sensitive in India. We utilize our resources very well. So I think it is very important that you take it every day in the morning, and then you find a mechanism of taking it. as you know what you would remember and how you would remember. Some people find it challenging to take it in the morning and then wait for some time because of various professional issues or running around school jana bachcho ki tayari karni whatever xyz. So then you can, if you can take it in the evening and have a 4 hour gap from the last meal. That is still an accepted way of doing it. So 4 hours from the last meal. And in our country, see, we have a beautiful mechanism that the breakfast and the lunch are often together, and the lunch and dinner is often a big gap,
Yeah.
generally speaking. Because people have
Yeah.
dinner at 11 o'clock, lunch at 2 o'clock. And if you're not snacking at 5 o'clock, then you can take evening में आप जो lunch के बाद 4 घंटे का, so that your stomach is empty, and then you don't eat anything for some time after you've taken the thyroid. So if people have a problem in the morning, they can use it to take it in the 4 hour gap from the last meal and make sure you don't eat and drink anything. So that's
Got it.
another, what we say, negotiation on the table if you really have no choice.
Cool. अब्दुल कलीम जी का क्वेश्चन है. कलीम जी पूछते हैं, हेलो सर, गुड मॉर्निंग, दिस इज कलीम, 32 year old. आई एम टेकिंग 200 mcg from the last 3 months. Is it good for health?
तो कलीम जी, आपका बॉडी वेट अगर आप बता दो तो बहुत अच्छा रहेगा. आप टाइप कर दो इफ यू आर लिसनिंग टू मी. बट 200 mcg if you are taking, then there's something odd. So something is odd. Generally, 200 mcg we do it in very rare scenario. So something is off the radar for you. So I would suggest. Obviously, it's very difficult to know more, tell you more because without knowing your medical details, that you consult an endocrinologist because it seems a little odd why you need 200 mcg unless your body weight is 200 kilograms.
ये 140 क्या है कलीम जी? आपने जो टाइप किया है, आपका वेट है या आपका टीएसएच है? 140
So
उन्होंने
I
टाइप किया. So let me
so
see, let
maybe
me wait for
that
this.
is maybe he's saying
Yeah.
140 kilogram of weight. So
Uh,
still, that if it's 140, yes, you may need a much higher dose. But I would seriously consult an endocrinologist if you're not consulting one to find out whether that's appropriate for you or not.
Okay, okay. So Abdul Kalim ji, you will find Dr. Mithun Bhartia on Apollo 24/7's panel. You can definitely consult him. So with that, I think it's a specific case which we cannot discuss here. I will leave that for a personal consultation and move on to the next question. Just random human, इनका नाम एज जेंडर कुछ दिया नहीं है. Random question पूछते हैं, is hyperthyroidism hereditary? That's my question too, because my parents have it, I have it, and my daughter also has it. So is this hereditary?
So randomly, our jawab ये है कि there are so many good things we inherit from our patient, and we wouldn't like to change our parents. उसके साथ थोड़ा थायराइड आ गया तो आ गया, उसको आप उस पर फिक्र मत करो. आप अपना हर साल थायराइड चेक कराओ. If you get it, rectify it. No point blaming the genes. There is some inheritance, and there is a more female preponderance uh, in there. So yes, there is a genetic composition that is available. But rather than focusing upon or blaming your mother or your father, most likely your mother saying आपके कारण मुझे ऐसा हो गया, think of the good many things that you have inherited from her. This will be a very small proportion in comparison to that.
Yes, doctor. But doctor, stress क्या add कर सकता है? When I was detected with thyroid imbalance, I was at a point of, at that point in career and personal life, highly stressed थी, and I did attribute my thyroid imbalance to stress. Is this true?
So it's a little difficult to say that there is an association. Yes, there can be an association in a lot of people, but thyroid on itself can also cause neuropsychiatric manifestations. So that
Okay.
is when I say when you are depressed, when somebody is diagnosed with depressed, one should before giving antidepressant check their thyroid levels because the depression could be just because of the thyroid abnormality that is there.
Yeah.
And again, a lot of people who have got overactive thyroid will be very anxious, very agitated. So when the hormone imbalance as it controls everything, including the mood and other things, so people will have some changes that are there, but it should settle down if it is because of the thyroid. And if it doesn't settle down, then you consult a psychiatrist for help. Otherwise, you may end up
बट
on the wrong side.
सिचुएशंस बियॉन्ड माय कंट्रोल, जैसे कि वर्क रिलेटेड स्ट्रेस हो सकता है, या एनी सिचुएशन दैट डिमांडेड or caused immediate kind of stress at that point, will that have any effect on thyroid function?
So not necessarily, but there is a condition in which we say called thyroiditis, in which the thyroid becomes very angry.
Okay.
In that case, there is seem to be some association with stress, and people get it when they are stressed. But again, you cannot make a causality and cause and effect and cause a complete relationship between the two. And when we say that you've got thyroiditis or there is inflammation, we ask the person to leave that person there for some time. Say, if I have a fight with my wife, I would rather not step in the room when the volcano is about to burst. I would rather step out when everything is cooled down than come back in the house. So when the thyroid is angry, it's overspilling all the hormones. Let it be, let it quieten by itself. Don't do chera cheri with other medications. Don't do chera cheri trying to reduce its effect or increase its effect. That your endocrinologist can guide you, because let it settle down. It's a powerhouse that is controlling your metabolism. If something is off or something is on, say our computer is malfunctioning, we switch it off and switch it on. So let it auto regulate itself by itself, and often it gets to rectify by its auto regulation.
कितनी अच्छी बात बोला है आपने कि हार्मोनल हेल्थ में हार्मनी है. सो प्लीज अंडरस्टैंड दैट इफ यू वांट हार्मनी इन योर लाइफ, मेक श्योर दैट योर हार्मोन्स आर इन हार्मनी, एंड उनको पीस
100%.
रेस्ट कर दो उसको. बस नाइस.
By
थैंक
peace.
यू.
By peace. Yeah.
Navneeta is asking next question. Navneeta Ullengala. Is Hashimoto's different than and intense than the normal hypothyroidism?
So Hashimoto's, when we say, it sounds like a big Japanese disease that you've got. Because Hashimoto's thyroiditis हो गया आपको. So, if I write that big technical word, it also seems that you've got a big condition. So I'm away from thyroid calling it a disease. It is a condition that one has and an imbalance that one has to manage. Now, when we say Hashimoto thyroiditis, we are basically saying that you have got an autoimmune kind of malfunctioning of your thyroid gland. That is all it means. Because Hashimoto is a kind of an autoimmune condition. So if you did some antibodies for the Hashimoto's, which is generally a waste of money and time, you might find that elevated, and you might say that now I need to take my medications, but that will not change your prescription. See, a doctor should only do the test which is going to change my pen. So if I do, a lot of people do antibodies called TPO antibodies, and there is an association, it will go up with Hashimoto's thyroiditis, but is it going to change my prescription? And if it is not going to change my prescription, I should not ask my patients to do that test, because it is not good, right or wrong practice. Yes, and you'll get more scared, because then you'll start asking me, my antibodies are 500 or 800 or 900, and the fight is continuously on. वो फिर वापस चेक कराएगा, सर कम क्यों नहीं हुआ, पहले 900 था, अभी कम हो जाना चाहिए आपकी दवाई से. So there's no point misdirecting the patients. We should just stick to what is needed. And to simplifying the question that you've asked me, it is not any different from any underactive thyroid that you are having. If you're taking thyroid or thyroid hormone replacement for Hashimoto thyroiditis, it is neither more dangerous or less dangerous than what you would have for any other condition. Any other condition which comes with the thyroid.
Right. So yes, weight issues के बारे में अभी हम बात करेंगे. Now a lot of people are asking about weight. Ashira, sorry, not Ashira. Nishat Fatima Khan is asking how to reduce weight. Thyroid की वजह से ये blow up हो रहा है every day, and also way beyond, वो भी पूछ रहे थे पहले से कि how do we reduce weight while our thyroid is in an imbalanced situation?
So, प्रतिमा जी, अगर मेरे पास कोई मैजिक बैंड हो, मैं ततात्सु कर दूं, सबका वेट ठीक हो जाएगा, मेरा खुद का, लेकिन ऐसा है नहीं. तो अगर आपका थायराइड के कारण आपका वेट गड़बड़ हो रहा है, तो आप जब वो थायराइड अगर ओवर एक्टिव है या अंडर एक्टिव है, उसको करेक्ट करोगे, तो उसके कारण जितनी खामी थी उतनी ठीक हो जाएगी. बाकी आई थिंक व्हाट वन नीड्स टू बी अंडरस्टैंड, एंड आप ये मेरी सोच है, मेरी सोच गलत भी हो सकती है. यू आर ब्यूटीफुल एज यू आर, and then you want to exercise, you want to control your happiness is more of a key. Don't let this size zero, advertisements and commercialization of the size zero. In fact, nowadays we get mannequins in when we go to buy clothes, which has got so normal people having a little bit of a pot belly, having a little bit of this, which is normality. Then when you are buying it, it looks better. So love yourself how you are. Yes, if you want to lose weight, try like to lose weight. बट द थायराइड के कारण जो होगा वो आपका थायराइड को आप जब दवाई लोगे रेगुलरली तो उसके कारण रेक्टिफाई हो जाना चाहिए. जनरली जो हाइपरथायरॉयडिज्म होता है जिसके कारण ज्यादा वेट लॉस होता है उसमें हमारे पास पब्लिक कम कंप्लेन करती है बिकॉज दे आर लूजिंग वेट, दे आर वेरी हैप्पी. दे सेड सर दवाई लेके हमारा वेट गेन हो गया है because they've lost artificial weight which has been regained on replacement. So I think it will, it will bring you back to what you were. And I think one question that you must always think, what was I before I was diagnosed thyroid imbalance 2 years ago? और अगर आधा 1 kg का फर्क है तो ये याद रखिए, हम एयरपोर्ट जाते हैं तो घर में वजन करके जाते हैं तो स्पाइस जेट इंडिगो हमारा 1 kg का ओवरचार्ज ले लेते हैं क्योंकि उनके काटा में हम 1 kg ओवरवेट होता है. तो आधा kg 1 kg की लड़ाई मत कीजिए.
Yeah. ठीक है डॉक्टर, थैंक यू सो मच फॉर गिविंग दैट पॉजिटिव reiteration. And body image is something that we all hold really very harsh on ourselves, and we shouldn't be as harsh. And I'm here as an example where I've been with imbalanced thyroid for a very long time. I'm taking care of myself, I work out regularly, I eat well, and I'm very happy with the kind of weight that I have around, and I'm very comfortable with my body.
Exactly.
Yeah. So, doctor, here's pregnancy-related questions. Kavyashri and Ashira, both of them are asking, in pregnancy, I got thyroid, and after delivery, I'm very weak. I can't even hold on anything for a long time, not even my baby. That's Ashira. And Kavyashri is saying, I had thyroid issues during pregnancy, but after that, in a blood test, I have my TSH is 3. Will my thyroid come back? I mean, I understand that she's worried about her imbalance coming back. So would you
So I
want to throw
think
some?
there are roughly 2 questions. I'll just explain that. But before that, to the first question, the second part, use it an excuse and ask your husband to do the work for the child. कि मेरे को तो
Ashira ji,
thyroid हो गया, संभाल लो. ठीक है. So that's on a lighter note. But what I'm trying to say is there are 3 problems that happens with thyroid in pregnancy. Number one, people who have underactive thyroid may find it difficult to fall pregnant. And if you are planning pregnancy, your thyroid level must be very good control before you plan a pregnancy. And you must take some folic acid 3 months before you plan the pregnancy. So it should be a planned pregnancy, not ki ho gaya aap kya kare. So that is very important. Second, during pregnancy, your body requirements increase because now you need thyroid for your bacha also and for yourself also. So especially in the first few trimesters when the body and the brain and everything is getting formed. And God has created a child or in a mother's womb so beautifully that it is like a parasite. It will take what it wants from the mother, leaving the mother very little for herself. So you need more thyroid for yourself and for yourself in the pregnancy. So in pregnancy, if you're on thyroid replacement, if you are underactive, your dosages are increased temporarily during the period of pregnancy. And after pregnancy, generally speaking, you go back to your pre-pregnancy dose just after delivery. That is for underactive thyroid. Now, if you've got thyroid in pregnancy, just in the time of pregnancy, that is your doctor tweaking your, just you never had thyroid and suddenly you found yourself thyroid during pregnancy. People fight about these TSH levels of 2.5, 2.2, 2.3, 2.8, whatever they can say. But one thing which I would say is number one, what a common person can think of. So, 2 common tips. Number one, always check your thyroid in an NABL lab. NABL lab, which is a quality control. जैसे हम बोलते थे ISO का थप्पा लगता है कोई चीज ये सामान अच्छा है, वैसे ही NABL लैब में ही आप अपना थायराइड टेस्ट कराएं. सेकंड, आप सेम NABL लैब में ही दूसरी बार कराएं. एक बार मारुति का टायर लगा दिया, एक बार सेंट्रो का टायर लगा दिया, एक बार मर्सिडीज का टायर लगा दिया, तो आप उसको इक्वेट कैसे करोगे कि मेरा टायर का हवा कितना जाना चाहिए. तो यू मस्ट यूज द सेम NABL lab that you are doing, and you must do it in that lab only so that there is a comparison with what you are having, because we do a lot of lab shopping in India. डॉक्टर शॉपिंग भी करते हैं, और लैब शॉपिंग भी करते हैं। कोई कुछ ऑफर आ गया था, हम करा लिए 500 रुपये में, 800 रुपये में, या जो भी, इनके पास चले गए थे, वहां चले गए थे, ऐसा करा लिया। सो स्टिक टू अ गुड लैब इन योर एरिया, who you have faith in, which is an NABL lab, and repeat it in that lab only, so that it's easier for you to actually make a correlation that is there. And the pregnancy question is that if you never had thyroid before pregnancy, and your medications were only low dose during pregnancy, then maybe you don't need thyroid. The doctor might check you after a few months in pregnancy, because pregnancy levels of normal range are different from normal non-pregnant levels. So you might have to decide which way you are.
So, but it is important to get yourself checked in pregnancy and after pregnancy to decide which dosage, correct, doctor? So, if you
100.
require, yes, wonderful suggestion there. And Apollo 24/7 has labs all across India, and you can access Apollo 24/7 from the ease of your house and get the samples collected as well. So here's an interesting question. Jajabor, इनका नाम नहीं दिया है. Laziness or lethargy, is this a sign of thyroid imbalance for a person who's already under thyroid medication?
Yeah, so if you are under thyroid medication and your thyroid hormones are within normal limit because of the replacement, then you can use the laziness as an excuse to not do housework. Otherwise, it will work.
But no, doctor, is that also an indication कि आपका dosage सही नहीं है, कि आपको एक टेस्ट करवा के आपको
लेकिन
repeat करवाना है?
लेकिन वही मैंने बोला, अगर आपके रेंज में आ रहा है, especially if you are in the mid normal range of your blood test, and you're still feeling lazy, then it is not the thyroid. तो
It's
उसके
not.
कारण अगर आप, then it is not the thyroid. Then we have to search for another excuse for your laziness.
Right. So, and one more question. How often do you check a TSH? Because यहाँ Mr. Manju is asking this question. They keep checking their TSH for every 4 months, but it keeps changing 7.8 to 21.8, and 50 mcg last 4 years से ले रहे हैं, weight 78 maintain करते हैं, but ये frequently check करते हैं, frequently ranges भी बदलते हैं.
तो मंजू जी
When
मैं
do we?
सो मंजू जी मैं ये बोलूंगा कि एक तो अगर आपका थायराइड टेस्ट नॉर्मल है, तब आप उसको 4 से 6 महीने में आप चेक करो जो आप कर रहे हो, लेकिन खाली TSH ना करो, करो तो पूरा प्रोफाइल करो, बिकॉज TSH इज नॉट द एक्चुअल हार्मोन. TSH इज जस्ट अ रेगुलेटर. फॉर एग्जाम्पल, फैन घूमता है, हवा तो फैन से आती है, रेगुलर उसको रेगुलेट करता है. तो कल हमें हवा कम आ रही है तो हम रेगुलेटर को ज्यादा घुमाते हैं, या ज्यादा हवा आ रही है तो रेगुलेटर को कम घुमाते हैं. सो द एक्चुअल हार्मोन्स आर T3 and T4. If your body is producing excess, what I'm saying when we talk about hypo, if your body is producing less hormone, then your T3, T4 are low. And the body then thinks कि यार ये लो हो रहा है, रेगुलेटर को तेज करो, TSH ऊपर कर देता है बॉडी to compensate, to try to get more T3, T4 secreted by your thyroid. सिमिलरली अगर फैन बहुत फास्ट घूम रही है और आपको हाइपरथायरॉयडिज्म है, बॉडी इज प्रोड्यूसिंग टू मच T3, T4, देन बॉडी TSH का रेगुलेटर को लो कर देती है, ताकि योर बॉडी इट गिव्स अ सिग्नल टू द थायराइड टू कम डाउन. So one request would be, you always check your T3, T4, TSH in an NABL lab. You take your medication regularly. क्योंकि जो आप फ्लक्चुएशन बता रहे हो 5 or 21 on the same dose is a little unusual. थोड़ा बहुत आगे पीछे हो सकता है, 5 का आप 6.5 बताते, थोड़ा बहुत इधर उधर हो सकता है. 5 का अगर 20 हो रहा है, तो या तो आप दवाई कभी कभी में चोरी कर रहे हैं कोई कारण से, या फिर कोई और कंडीशन है जिसके लिए आप एंडोक्रिनोलॉजिस्ट को काइंडली कंसल्ट करें.
All right. So once the dosage is set, for example, my daughter has been a recent find with her thyroid imbalance. She is just 19 and 20, between 19 and 20 years. So how does one set the dosage? How often does one require to meet an endocrinologist to maintain that kind of thyroid health?
So as a rule of thumb, Jhansi, what I say is that if you had no change in your thyroid dosing, say she is taking 75 and she has been taking 75 now for the last 6 months, and I have not fiddled with her dose and does not require a change, then you can be left alone for a yearly test or 6 monthly test by yourself. If I
Okay.
fiddled with the dose, if I've changed something, then I would like you to see the person every 2 months before the dose has stabilized, because I've fiddled with your system. So I want to know, when I've fiddled with your hormonal system, whether the fiddling has been right or the fiddling needs more fine tuning. So any change which has been done with your doses, we need to be seen more frequently. If there is no change, you can be left alone for at least 6 months without any hassle.
But otherwise, it's an annual checkup. For somebody like me, it's an annual checkup.
If you're having the same dose, you've been having the same dose for the last so many years, it's like an annual MOT that you do your car checkup. Like, you can do your your sugar, your cholesterol, your thyroid once a year, then that's fine.
Wonderful. All right. So, doctor, next question is about thyroidectomy. Mr. Manoj Singh is asking, sir, I have got complete thyroidectomy surgery, and what else does he has to maintain to do his maintain his health, and any vegetables or fruits to be avoided?
So, Manoj, by the sounds of it, we do a complete thyroidectomy when a person is thinking of cancer. Okay, or there was a big unusual swelling in your thyroid on your neck which was causing difficulty in your breathing because it's causing pressure symptoms on the neighboring areas. So if your thyroid is not removed, you don't have any thyroid hormone production. Now you need to take tablet every day in the morning like you brush your teeth. That is all you need to do. That is the only precaution that you need to have. You don't need to avoid any tablets or food, which we have already discussed. Within moderation, within sometimes, if you really love cabbage, you can have cabbage occasionally. But other than that, nothing to worry. Take your hormone replacements that are going, but do find the cause of your complete thyroidectomy.
Yeah,
Many
that's
people
important.
who had the complete thyroidectomy done, Jhansi, many years ago, they are not aware क्यों किया गया. इनफैक्ट आई
Ah,
हैड सीन अ पेशेंट जिसको कैंसर था, बचपन में हो भी गया, उसको पता भी नहीं कि उसको कैंसर हुआ था. When I asked him to go and get his note from his parents, he brought it. So आपका complete thyroidectomy का reason has to be very clear in your mind. Why was it
wonderful.
done?
Yes, yes, that is important. Please go ahead, Manoj ji. पूछ लीजिए. So next question is Mr. Johnson's question. Kindly tell me whether there are any specific neck exercises to maintain an active thyroid balance in our, and what's the lifestyle that you would advise?
Yeah, so there are certain yogic exercises which they say are good for thyroid. When I do my yoga instructor also tells me, "ये कीजिए आपका thyroid अच्छा होता है." I just smile at him. I don't say anything to him. So do you do all exercises that you should do, which is for good body posture, body balance, and everything. I don't think there is any randomized controlled trial which says that आपने ये exercise किया इसलिए आपका thyroid normal हो गया या abnormal. I'm not very much aware of any scientific evidence backing it, but do what your body needs to be in good balance. Exercise is good, both aerobic and anaerobic.
Wonderful. Quick question, Subarna Roy. My anti-TPO antibodies range is more than 1000 UI per ml and TSH levels are 23.5. Weight is 39 kgs. What should I do in this situation?
मैंने जैसे आपने पहले सुना होगा टीपीओ एंटीबॉडीज, तो मैंने बोल दिया पैसे खर्चा मत करो. अगर आपको खर्चा करना ही है तो आप मेरा कंसल्टेशन करके मुझे ही दे दो, लेकिन टीपीओ एंटीबॉडीज आप मत करो. रियली जोकिंग ऑन दैट, don't waste your money on TPO antibodies. It's a full waste of money. Your TSH levels are high. Your dose does needs changing. You need to speak to your endocrinologist if you have one, or consult one to get your thyroid level back in range. But don't waste your money. Don't fight about TPO. Just erase that from your memory ever that existed. कि वो मेरे साथ कभी कुछ हुआ भी था. So erase that. Don't try to recheck it again to save your money.
Yeah, so trust the lab, which or Apollo 24/7 or any other lab, but not necessarily that you do every test that comes across and not every
Yes.
test. So please select the right package that is for you and as per your doctor's advice. Ramya Nagaraj's question is the next one. After pituitary adenoma surgery, I'm taking 100 mcg of Tylenol. What should be the thyroid levels to continue the same dosage or reduce? Okay.
So let me
Yeah, that's
explain that for other viewers. Pituitary is that mutter-sized gland which I told you, which controls the thyroid gland. So if he's had a surgery of pituitary adenoma, they've removed the pituitary, which was actually controlling the thyroid. and that is why you are on 100 microgram replacement. Now, if you are taking pituitary hormone replacement, you have to take it for life because that auto regulation is also gone. However, your levels of T3, T4, TSH may have to be differently viewed than a normal person who has got simple thyroid issue. So speak to your endocrinologist for adjustment. You need it for life. As long as your T3, T4 are within normal range, in mid-normal range is what I would aim for. So if the range of say is between 6 to 12 in your lab, around 9 to 10, if you're somewhere around mid-level range, then you're well replaced. Your TSH may be a little different because if it's of your pituitary condition, but I'm not aware fully in full details of your pituitary condition. But what basically I'm trying to say is that you need thyroxine replacement for life. Number one. Number two, you need to be in regular contact with an endocrinologist at least 6 monthly because of your pituitary condition. Because some pituitary conditions tend to come back.
All right, all right. So Ramya, please get yourself checked as much as doctor's advice. And there was one thing. How do you get your TSH checked? और कभी भी अगर आप थायराइड पैनल टेस्ट दे रहे हो, मेडिसिन लेके लेना है या देना है या विदाउट मेडिकेशन देना है? This is one question Ramya has posed.
Ramya, excellent question. I think this is the question of the day, if I could say. So, if you really have to have your thyroid checked, first of all, do it at the same time always because the thyroid levels also changes. So, best thing is to do it in the morning before
Okay.
10 o'clock. If you do it, that is the best time to check it. And always don't take the tablet on that day that you are having it checked. That is ideal. So on the day of your check, don't take the tablet, test करके ले लो. ऐसा नहीं कि आप उस दिन मिस कर दो. I'm not saying that. So if you really want an ideal scenario, that is the ideal scenario I would say. However, if you cannot do that because of various ecosystems, then at least time it at the same time every time, so that there is some equilibrium system because the hormone levels change throughout the day. So we are trying to, the point of comparison should be the same.
Yeah, yeah. Thank you, doctor. So here's Ganesh Sharmaji's question, which is looking critical to me. He wants to understand if high thyroid has an impact on baby's mental health in the womb. My wife is already under medication, but low dosage. But when we checked in the first and the second month of pregnancy, 84, but later it has come down to 4.5 and she's 6.5 months pregnant. Will the child have any kind of impact?
So it's a difficult question, but let me simplify your question. When you are, because the language has changed, hyper and hypo, generally what he means to say, when common people say, मेरा level बहुत high है, they mean that the TSH is high. Most people, when they say मेरे levels high हैं, what they're trying to say, the language that they are trying to say, because they're only checking the TSH. So they always say that my levels are high. They generally mean my TSH is high. So what you are telling me is your wife has got hypothyroidism. Your TSH levels were very high. Your doses was increased. TSH has come down. Will it affect the baby or will it not affect the baby? Very difficult to answer that question. But generally, as a rule, we say people who are falling pregnancy, that is what I said, the pregnancy has to be planned with appropriate normal levels of thyroid hormone with some folic acid replacement before you plan pregnancy. Sometimes things
Right.
happen and you find yourself that you are pregnant, then there are certain tests that your gynecologist may be able to do if because of the thyroid your child is having some genetic problems like Down syndrome. They may be able to check with a blood test to look for trisomy 21, which can help you, or they can look at some 20 weeks full scanning of your body of the baby in which they see the organs well developed or not. That will give us a 20-week scan, will give you a very good idea. And speak to your gynecological obstetrician who's looking after you, and he or she might be able to give you more details.
Yes, doctor. Thank you so much, Ganesh Sharma ji. Please be on the lookout. Please be aware of the condition, and please do get all the tests that were advised by Dr. Mithun, and also be under consultation with your gynecologist. One simple question from Dhanya, 20-year-old with recently diagnosed hypothyroidism. Uh, Are migraines and blackouts related to hyperthyroidism?
Not necessary. So blackouts, not necessarily, because unless you are, yes, very rarely people might go into coma with hypothyroidism. But if you're talking to me, if you're typing this question, I don't think that has happened to you, and I don't want that to happen to you. But generally, if you're having blackouts and if you're having recurrent migraines, it is generally because of some other condition that is there. Uh, do take advice to see if there is any other co-conditions going towards it that is happening alongside.
All right. Thank you, doctor. So Lakshmi Kantam is asking, daughter's 13-year-old having antibodies positive for hypothyroidism, taking 75 mcg from the last 7 years. बोले तो 13 साल की बच्ची 7 साल से ले रही है, and her free T4 is lowering is increased to 6.8. Suggest how to become normal, how to bring it to normal.
हाँ, तो ये बहुत अच्छा सवाल है। देखिए कितने सारे सवाल एंटीबॉडीज पे आते हैं, इसलिए मैं आपको बार बार बता रहा हूँ, एंटीबॉडी की फाइट छोड़ दो। और अगर आपके डॉक्टर अगर एंटीबॉडी को किसी ने लिखा भी है तो उनसे पूछो कि सर अगर हम ये एंटीबॉडी कम कर लें तो क्या फायदा होगा। सवाल हमेशा पूछना चाहिए। लेट हिम आंसर योर क्वेश्चन, नेक्स्ट टाइम व्हेन यू सी योर डॉक्टर कि आपने एंटीबॉडी टेस्ट किया था, अब इसको कितना कम करें कि मुझे ठीक होना चाहिए। So the TPO antibody fight is something which I don't want to get. As I said, I don't see any value of doing it. Now, your 13-year-old child needs thyroid hormone for her development and growth. So you must replace her well. Now, another question which you have brought out, which is very nice, is I'm checking her free T4.
हाँ.
So what is the difference between free T4, free T3 and total T4 and total T3? हमें free T4 करना चाहिए या हमें total T4 करना चाहिए? राइट क्वेश्चन है। अब इस
Yes.
क्वेश्चन का मैं आपको रिवर्स जवाब देता हूँ। I've got a son who's going to college. Suppose he decides to marry a girl. I would like him to marry a girl of his choice, but I would like him to marry a girl who's not married. I wouldn't like him to get married to somebody who's already married. So there is something called sex hormone binding globulin, which are there, which is married to a lot of thyroid hormones, and only the free thyroid hormones are which really act in our body, in our equation, which comes. So you want a free girl or a free boy for your child. So that's why a free T34 and a free T3 test are a better test than T3 and T4. However, saying most of the labs are not well equipped to doing free T3 and free T4. So, as a rule, total T3 and total T4 is a better test, a cheaper test to do in most cities, in most places in India. And if then your endocrinologist wants to do a free T3, free T4 test, then you should do a free T3, free T4 test, not as a rule of doing a free T3, free T4. It is double the cost. It will not add any value if the lab is not a very good, reliable test. For your daughter, you must bring it in the mid normal range of that range that you are using of that lab, because she needs the thyroid. She is a 13-year-old, she is still developing. You need her to develop her, everything, her ecosystem better with good thyroid hormone replacement. So you must make sure her thyroid hormones are, in the mid normal or above range at least to be replaced. And T3, T4, if you do not have an excellent lab who can give quality free T3, T4, then don't fall trap into packages of that you will do the whole body. You do total T3, total T4, TSH, and take it from there.
All right. Thank you so much for that advice, doctor. Doctor, understanding that children and growth, ये एक age होता है, and if they are detected with thyroid imbalance, how can it be, how can we help them? As you said, अच्छी तरह से उनको भी उनका ecosystem develop करना है. Lovely word that you used there. So how can we help them?
बिकॉज बच्चों को कुछ हायर डोजेज चाहिए होता है, वो ग्रोथ है, उनकी नीड ज्यादा है। तो अगर आप बॉडी वेट का भी देखें तो उनकी नीड ज्यादा होती है। सो दैट इज वाई अ लॉट ऑफ पीपल गेट स्टंटेड ग्रोथ। अगर उनका थायराइड अच्छे से रिप्लेस नहीं करते तो उनकी हाइट नहीं बढ़ती। फर्स्ट कॉमन टेस्ट अ पर्सन शुड डू व्हेन यू फाइंड दैट अ चाइल्ड इज नॉट ग्रोइंग इन हाइट इज टू चेक देयर थायराइड फंक्शन टेस्ट। इट्स अ सिंपल टेस्ट, simply replaced by one tablet. Thyroid tablets are not very expensive also. So in fact, it is maybe the whole price of it is less than a packet of crisps per week that your child may be consuming every week. So it is as cheap as that. So something which you can easily replace, something which you can, get wonderful things done for your child, you should get it done.
यस एंड आई थिंक ये डरिएगा नहीं, हमारे यहाँ एक मिथ है, अरे बाबा एक बार इसको टैबलेट खिला दिया तो लाइफ भर उसको खाना ही पड़ेगा, तो पहले मत दो. सो दिस
तो
इज
रोज
वन
ब्रश
मिथ आई हैव कम अक्रॉस.
एग्रीड, रोज रोज ब्रश भी तो करते हैं ना. तो ब्रश तो रोज करते हैं, रोज नाश्ता भी करते हो, रोज लंच भी करते हो, रोज डिनर भी करते हो, रोज आप तैयार भी होते हो, तो रोज साबुन भी लगाते हो चेहरे पे, या फेस वॉश लगाते हो आजकल, तो रोज तो आप वो करते हो. लेकिन ये ना डरो, आपके साथ आधी जनता खड़ी है जिसको थायराइड का प्रॉब्लम है, तो आप अकेले नहीं हो. You are not anything special. Not people will draft you as something very special. You are part of a world, and if you shout around your, go out of your house and shout in your locality, you will say, many people will, the ego is going to come back that they also have got thyroid. So you're not alone in this. So
Yes.
be rest assured about it.
All right. So, Lakshmikantam Garu, about homeo or Ayurveda, we'll not be able to answer here because here we have an expert from allopathy, so we'll not be able to take your question. But, Doctor, one quick question. I'm surprised that nobody has asked about PCOD and PCOS yet. But how does, one last question before we get on to top tips, how does thyroid and its imbalances affect the other hormonal health?
So I will also, I'll answer that question which you have skipped also about Ayurveda and
Okay,
homeopathy as
Doctor,
well.
please go ahead.
So what I will say is that, see, when a lot of people do have alcohol nowadays as social drinking. तो अगर आप रम पीते हो, आप विस्की पीते हो, आप जिन पीते हो, वोडका पीते हो, आप कभी ड्रिंक्स मिक्स नहीं करते. आप ड्रिंक्स मिक्स करोगे तो गड़बड़ हो जाएगा. तो आपका जो ड्रिंक है, अगर आपको उस ड्रिंक पर पूरा फेथ है, अगर उस ड्रिंक के पास पूरा साइंटिफिक एविडेंस है कि वो कैसे करके आपका लेवल करती है, एंड आपको पूरा विश्वास है, तो आप उधर रहो. मैं थोड़ा ये खा लेता हूँ, थोड़ा आयुर्वेदा भी खा लेता हूँ, थोड़ा होम्योपैथी भी खा लेता हूँ, ये मत करो कि हमें आयुर्वेदा का नॉलेज नहीं है, आयुर्वेदा को एलोपैथी का नॉलेज नहीं है, तो फिर आप किसी के नहीं रहोगे. इट्स लाइक हैविंग 4 गर्लफ्रेंड्स एट द सेम टाइम. स्टिक टू वन पर्सन, whoever you want to stick to. The second question is a very nice question. PCOS is a wonderful diagnosis. Most of the young females nowadays has PCOS diagnosis. My job as an entrepreneur is often to tell people they don't have PCOS rather than they have PCOS. It's like it's diagnosed like a drop of a hat by everybody. Now PCOS, when we talk about, is there's a correlation with PCOS and thyroid. If you've got hypothyroidism, that is underactive thyroidism, the body is producing less thyroid, there may be appearance, cyst-like appearance in your ultrasound, which you may mistake like polycystic ovarian disease. PCOS may has effect on the TSH levels, and TSH level will also have an effect on the PCOS pattern. So there is some interrelationship that is there. Diagnosis of PCOS should not be done loosely. It's very, very loose diagnosis that is done. It is as loose a diagnosis that is done that a person is said that you've got thyroid. And that is one important thing, that people get diagnosed as thyroid also very, very easily.
Right.
So that often I think that drug companies don't like me because I take people off their thyroid medications when they don't need. So I'm a less prescriber than an over prescriber. That is our job as an endocrinologist.
I have every reason to love you a little more today, Doctor. Thank you so much for being on this show. So
Thank you.
here we wind up the show today, but we would want you to give us top tips to maintain thyroid in its good balance.
So I think, thank you, Jansi. It was wonderful. One top tip of the day is that be very careful when you label yourself or your family member as a hypothyroid or a thyroid, underactive thyroid. Because अगर कोई को हम मांग में सिंदूर डाल के उनको बोल देते हैं आज आपकी शादी हो गई, तो वो मांग से सिंदूर हटाने की हिम्मत लोगों में नहीं होती, और एक बार वो थाप लग जाता है तो फिर बहुत मुश्किल होती है. सो देयर आर वेरियस प्रॉब्लम जिसके इकोसिस्टम के कारण आपका थायराइड इम्बैलेंस हो सकता है, तो स्पीक टू योर एंडोक्रिनोलॉजिस्ट अबाउट इट. The second tip is that if you have thyroid, it's not the end of the world. Take your medication regularly, enjoy life. God is very kind to you. He's just given you a small thyroid hormone imbalance, which you can easily rectify and live life to the fullest. Third, always, the third top tip of the day, is you check your thyroid test in an NABL accredited lab, and generally the same lab all the time, because they may have different normal ranges based upon their reagents. So you stick to them so that the dose fluctuations is easier. And fourth, always discuss with your
It's 12
endocrinologist
o'clock.
if you have any confusion. Thank you so
Yes.
much.
Thank you. Quickly, I know I'm running out of time, but thank you so much for joining us today. Thank you. Thank you so much, Doctor.
Thank you.
Namaskar.
Bye
Yeah.
bye.
So, Kaylee, you've asked a very important question, but towards the end, Ramya, thank you so much. So, we look forward for you guys to join us in the health quiz as well. Watch out for the questions that I'm going to ask you on the show right now. Winner's name will be announced towards the end of the show. Winners will be selected at the sole discretion of Apollo 24/7 team. Winners, if I take your name, please write back to us at marketing at apollo247.com to claim your gift vouchers. The three questions for today are on the screen now. True or false? Factors like stress can worsen thyroid disorders. Question number 2, fill in the blank. There are how many types of thyroid disorders? Write the number there in the blank. How many main types of thyroid disorders? Question number 3, yes or no में answer कीजिए. Thyroid issues are caused by your body over or under producing the thyroid hormone. Is that true or false? Yes or no में type कीजिए. Thyroid issues are caused by your body over or under producing the thyroid hormone. These are the three questions for today. Please keep your answers coming in the chat box. Type either 1, 2, 3 or all three together. चलिए आज के लिए coupons भी दे देते हैं. Ask Doc 150. Use this code to consult top doctors direct from Apollo on Apollo 24/7. Get 150 rupees cash back on online doctor consultation. The code that you use is Ask Doc 150, and the next code is FIRST3. FIRST3. Order medicines direct from Apollo. Get 25% off on online medicine orders, and you can also get up to 2-hour delivery, which is also free. Chaliye, next is HH247. Use this code in addition to the others. Get up to 199 off on online consultation with Apollo doctors and up to 20% off on medicine orders as well. The code is HH247. And also, Apollo 24/7 is on WhatsApp. You can call or text on WhatsApp 9355247247 to avail healthcare services. And next week, we are talking about an interesting subject. We are talking about mental health in children, behavioral issues, stress, depression and ADHD. आपके घर में कोई हाइपर बच्चे हैं, बिहेवियरल इश्यूज है या ADHD अटेंशन डेफिसिट हाइपर डिसऑर्डर है, तो चलिए अब बात करते हैं कि कौन सा ये बचपना है, कौन सा ये किड्स बीइंग नॉटी है, कौन सा हाइपर है. So let's understand behavioral issues better. Join us next Sunday, that is 11th June, 11 a.m. and we shall get you an expert from Apollo Hospitals. And while I see Kushbu, Suran Kumar, Harminder, Suran, I'm seeing all of you are typing. Let me see who are our winners for this week are. Number 1 is Lakshmi Kantam and Ramya Nagaraj. And one more name that I'm going to announce, Anmol Agarwal. Lakshmi Kantan, Ramya Nagaraj, Anmol Agarwal, you are the winners for this week. Please go ahead and write back with all your details. Contact details हमें भेज दीजिए. You need to write back to us with email, name, number, address, with marketing at apollo247.com. All these details will be in the chat box as well for you to refer. And please claim your health credits. चलिए next हफ्ते मिलते हैं. नमस्कार. Thank you so much for joining this Sunday.